He's done a great job for us. Tom has listened to our concerns and our complaints and our needs, and he has in every way tried to meet them, and I really want to thank you for that. So today you have the honor of having him here. You can ask him questions. I think he's going to say a few words and then bombard him with your questions. And then remember, he's running for re-election this fall. As a Democrat, I'm going to vote for Tom Latham.
Thank you very much for everyone being here today, Mayor. I thank you very much. It is a real privilege to get to work with great people, and we work as a team around here, and that's why we have had successes. But the subject matter today is it's a seniors meeting talking about Medicare, prescription drugs, about what's happening in healthcare in Iowa and throughout the country, and how critical an issue it is, not only for you individually, but for our communities, as far as keeping our hospitals, our healthcare providers as great professionals that do such a tremendous job for us here. Make sure that we keep them, we have access for everyone. The Medicare situation today, as you all know, we've got real concerns about the reimbursement for our hospitals, for our healthcare providers, our doctors, nurses, home healthcare folks. And the number one issue with seniors today is the high cost of prescription drugs. And always keep in mind that when Medicare started in 1965, healthcare was much different at that time. Most of healthcare involved at that time people going into the hospital, invasive surgeries, that type of care. It's changed dramatically from 37 years ago to today, where most of the health care that you get is now with medications, outpatient coverage. And you're all aware under Medicare there is no outpatient medication coverage. You cannot get your drugs paid for, and that is the way health care is provided today. The average person in Medicare spends about $2,150 a year on prescription drugs and has at least 2 chronic health care concerns, whether it be high blood pressure or arthritis, diabetes, whatever. None of that is covered in Iowa under Medicare. And what we'll talk about today is the plan that we passed last Thursday night. Actually, it was Friday morning, around 2:30 in the morning, to help you and also address the reimbursement issues that we have here for our health care providers. But first of all, the President has made a video that, I don't know who's running the controls here, Jim. This is your part, Jim Overhome, and if you don't know, come on, Jim. Jim, works in my staff here in our office. We're in the federal building here in town. If you need anything and want to visit with us, contact with us. But the President made a message for us here that I can have you listen to the President.
Thank you very much. I'm honored to be able to speak to you for this important meeting. I want to thank you, Congressman, not only for inviting me, but for working so hard for this district, for this country. I'm pleased to have the opportunity to report to you on an issue that is vital to the health of seniors, the health of Medicare. For too long, too many doctors and too many Medicare patients have had to fight not only illness, but also bureaucracy. I want to save and strengthen Medicare, to make it less bureaucratic and more efficient. I also want to improve and enhance Medicare to help seniors where they need help the most, paying for their prescription medications. And that is why my administration is committed not only to strengthening Medicare, but to expanding it and ensuring that it offers seniors prescription drug coverage. The fact is that healthcare is changing, and Medicare must change with it. When Medicare began, healthcare usually meant hospital care. Today, healthcare often means paying for expensive, yet essential prescription drugs. And this creates challenges for many seniors. Too often, seniors are forced to choose between paying the bills or paying for medicine. This is a choice no senior should have to make. And I want to work with Congress to ensure that Medicare pays for prescription drugs. Recently, a group of House Republicans outlined 4 goals that they will pursue in passing prescription drug coverage legislation: lowering the cost of prescription drugs now, guaranteeing all senior citizens prescription drug coverage, improving Medicare with more choices and more savings, and strengthening Medicare for this and future generations. These are common sense goals that will mean extra dollars and better care for seniors, and I support them. I look forward to working with the Congress to get a bill passed that I can sign. The longer we wait, the greater the problem will become, and we've already waited too long. The current state of Medicare's trust funds and rising health care costs mean that Medicare's promised benefits are really not secure for the baby boom generation. The program needs to be strengthened and secured. Here are the main principles for strengthening and improving Medicare. 1, nobody on Medicare will see any change in Medicare benefits unless he or she wants it. There will be new Medicare choices, and all of these choices will offer prescription drugs. Medicare plans will compete based on services and premiums. Medicare will respond better to the needs of seniors, and especially low-income seniors and seniors with high medical bills. And Medicare will be put on sound financial footing. These are principles that will strengthen one of our nation's most important sacred obligations, the health of our senior citizens. We will protect seniors now, offering exciting new life-saving services and more choices to seniors in the future, and guarantee access to prescription drug coverage. We will do it without overtaxing our children and our grandchildren. And let me mention one other program that is vitally important to our seniors: Social Security. I want to make this clear to our seniors. You have earned your benefits, you have made your plans, and I will keep the promise of Social Security. I'm committed to modernization that will not change Social Security benefits for retirees or new retirees. No changes, no reductions, no way. We will work to save and strengthen this vital program so that it can also work for younger Americans in the changing world of the 21st century. And that's why modernization must include individually controlled, voluntary, personal retirement accounts to support the Social Security safety net. Again, thank you all for allowing me to join you. I look forward to working with Congress to improve Medicare and Social Security for this generation and for generations to come. Our seniors deserve it. Our nation demands it. And we must get it done. May God bless you all.
Okay, like the President shares that all of our concerns about the way medicine is practiced today and it not being reflected in the Medicare program. We have had a very long and difficult year trying to get to where we are today. In the budget, we've set aside $350 billion of new dollars available for a prescription drug benefit and also to address the equity problem that we have here in Iowa. Now, there are some other folks, and I don't know, you might take note, the gentleman filming back here was with my Democrat opponent's campaign. So I hopefully this is not a partisan issue, because it isn't to me. Because I honestly believe with my own 85-year-old mother in Alexander, Iowa, and understanding her concerns about the cost of prescription drugs, and the fact that she is most concerned about the fact that a illness could wipe out everything that she and Dad worked for all of their